Hello. Teka, wait. Ba't parang baba ko dito? Wait lang. My model's too low. Ayan. I think... Ayan, okay na yan. Hello, everybody. Oh, there's a lot of people here. Hello, everybody. Hello, hello. Let's see who's here. Oh, Wendell, hello. Welcome to my Welcome to my YouTube stream, Wendell. This is your first time in my YouTube stream, right? Hello, Miko, iMac, hello, Tim, hello, Lemon, hello, Suguitan, hello, I Eat Sugar, hello, Garci, hello, Daniel Briones, hello, Jashi, hello, Leon Steele, hello, Ventix, hello, Archetype, hello, hello everybody, good evening, everybody. What do you mean I'm bottom? I am not bottom, I am top. I am top one. Okay, so what is tonight's agenda? Our agenda for tonight is, wait, why is my background that, hold on. There, we should be in the clinic. We should be in the clinic. Here we are, we're in the clinic now. Yeah. Our agenda for today is, well, actually, it's not exactly medical education, but we're gonna go through a lot of screenshots and some clips of, most of these are telenovelas or teleserie. Most of these are like teleserie stuff. Any teleserie, not exactly medical dramas, but like teleseries that have hospital scenes. I on Twitter I asked for like clips and screenshots if anyone had. No one actually no one commented any. I guess no one could find any. Well, it's kind of hard to find stuff like that. Even I had a hard time. Actually, my source for all of this is a Facebook page. Tapon. Hindi tapon. Top-pon. Top-pon. Okay, the source actually is a Facebook page, which a lot of doctors, or not just doctors, medical people follow, healthcare workers follow. It's called Chronicles of MD. I don't know if you guys know that page, but it has like 286,000 followers right now. And I got a lot of the photos from here because they share a lot. So they have some videos. I was able to save some of their photos so I don't need to go through their entire profile. But like the clips, we're just gonna go through their page and search for clips there. Let me just fix everything. Hold on. Okay, I think it fixed it. Yeah, I fixed it already. All right. Hey. Sounds like tampon. Grabe naman, tampon ng putik. Tampon? What the heck? Best lecture ito next to the Tuli stream. Speaking of the Tuli stream, so there's this someone DMing me on Twitter. It's a foreigner. It's not Filipino. I think it's a Caucasian who keeps asking me about circumcision in the Philippines. She seems so interested. I don't know. Nanonood ka pa ba ng teleserye? To be honest, I don't. That's why I had a hard time looking for these. I used to watch teleseries, but then I don't have time to watch teleseries anymore. So I just, I just know teleseries because of the memes and the random clips I see on Facebook. Magpapatuloy. No. Di naman siya. She's female, so paano siya magpapatuloy, diba? I don't know. I don't think that person is a VTuber fan. I think that person just stumbled upon my my tweet, like one of my tweets about circumcision, and then just started DMing me. So I think that's what happened. When I look at that person's profile, doesn't seem like a VTuber fan. Who the heck still watches teleseries nowadays? I assume they're still bad. I don't know. I don't even know what the new ones are. Like there have been okay. There were okay teleseries before that I watched. I mean, do you guys know? I'm sure you guys know Marimar. Marimar. Some culture have female circumcision. Yeah, that one is actually bad. Female, some cultures have it, but it's not something that is promoted. But yeah, I used to watch Marimar. The one with Marian Rivera and Ding Dong Dantes. That one. I just watched that one, but I didn't even really religiously follow it. It just got like the beginning was fine, and then after a while I just stopped. I just stopped. Yeah. Marimar. And there's another one. Aside from Marimar, there was another one that came out. The one with Rian Ramos was good. I mean, I liked it. I forgot what the title was. But it was the one where she became a where the main character was a guy and he became a girl. What is the name of that? It's the one with Rian Ramos and what's the name of the guy? I forgot. Did you watch the original Marimar? No. I forgot which one that was. There was a teleserye with Rian Ramos where he used to be a guy and then somehow he just became a woman. I forgot the name. Lalo La! Yeah, that's the one! Lalo La! That one. That's the one. Lalo La. That was the one I watched. I remember that one. And I don't know. I don't know what else I watched after that. Like I stopped after a while. I don't know I know Marimar was old. There's like the original Marimar, which is like, what is it, Mexican or something? I did not see that. I just watched the Marian Rivera one. I remember seeing that. Lalo La. Yeah. That one I watched. But I don't remember if I finished it. I would watch like the first few episodes or I don't know until a point, and then I just get bored. Yeah. Classic poor girl versus rich girl. Yeah, that's usually the formula. Okay. Anyway, yeah, for the agenda today is I got a lot of screenshots. Most of them are from Chronicles of MD. And we'll just go through some photos of or screenshots. I just downloaded any random screenshot that looked weird, and then I'll just criticize them, and maybe we can you know, go through what's the correct way and what's not what's the wrong way. All right, hold on. Let's go through screenshots first. Hold on. Okay, let's open this. I'm gonna open this and hold on, guys. Let me just fix it. This one should be. Oh, what? It's not showing. Why? What? Oh, okay. I think I better. Okay, I think it's better if I. Hold on. There we go. I think it's better if I open another thing here. Hold on, guys. Let's do it here in the just chatting window. Hold on. We're gonna. Where is that? Okay. Oh, image slideshow. There we go. Image slideshow. Yeah. Oop, nope, wrong. Wait, I'm just getting the files. They're like, I couldn't open it in like window. I have to open it as a slideshow. Hold on. Here we go. I think that's okay. There we go, yeah. Oh. Oh, there's one. There's one. Wait, hold on. It's so big. Wait. Eh. Oh god. Oh wait, what's happening? It's showing on. It's sliding. Hold on. Why is it automatic? No. Manual. There we go. Eh. Hi, Bread. Hello. Hello, Bread. Okay, here's one. Where do I put this? I'm gonna put here. I'm gonna cover the chat. I'm gonna cover the chat. Let's cover the chat. Hello. Yeah, Chronicles of MD. All of the stuff I got here is from Chronicles of MD. I will show the page later. Okay, yeah. Credits to Chronicles of MD. Thank you so much. I stole some stuff from you, but don't worry. I'm gonna advertise your page if ever anyone, if the admin of that page somehow stumbles across my on my stream or whatever. All right. Okay, let's start with this one. I can't. I covered the chat, bruh. Teka lang, Potek. Wait lang. Maybe I should just do it here. Teka lang wait lang. Kawawa naman kayo, tinakpan ko kayo di ba? Let's do it on a... Wait. Teka lang ha. Let's cover this. There we go. Wait. Okay. Let's do it like this. Ayan, para hindi kayo matakpan, di ba? And that, so that you guys don't get covered. Teka. Alright. Lumipat yung bala. Yeah, this one. I forgot what show this is from. Maybe you guys know. But apparently this guy, he got shot. I remember there was a video of this. I saw like the clip, but I can't find it. I remember seeing the clip of this. He got shot in the chest, and then he needed surgery. And then the next, and then they show this. He underwent surgery, and their incision is in the right lower abdomen. Nalunok yung ba? Yeah. So anyway, yeah, I think if I look closely at the surgery being done, it looks like an appendectomy surgery. I don't know. It's so blurry. Wait, let me look. Is it? It looks like an appendectomy surgery. So yeah, he got shot in the chest like multiple times. It looks like twice. And then he needed surgery, and they I don't know, I think they removed his appendix after he got shot in the chest. Anyway. Yeah, okay, but you know guys, when you get shot in the chest, especially in the if you look at this where he got shot in the left. Oh, is this left? Yeah, this is the left. He got shot in the left nipple line. This is a nipple line where this the one in the upper part is. And then he had another shot a little below the nipple line on the right. That's where the lungs are. So if you get shot there, and if the bullet goes through and through, most likely what the patient would have is hemothorax or pneumothorax. So when you have hemothorax, you would have blood within the thorax, either the right or the left, depending on where you got shot. Or pneumothorax, meaning you have air there, but it's not supposed to be there. and you would need a tube insertion. So if this guy got shot on both sides, he would need a tube on both sides of his chest. He would need a tube to survive. Yeah. You won't really die right away. You won't die right away. You can still survive this, actually. It won't be an instant death. You can still survive this if you are managed immediately. So, if the lung is bad, or if, you know, if the bleeding still continues even after you put a tube, there is a threshold of if the bleeding comes out of the tube, if the blood that comes out of the tube is more than 200 per hour in the next 2 to 3 hours. Am I right? Is it the next 2 to 3 or yeah, something like that? Or if your initial drainage, when you put a tube in here and you drain 1 liter of blood immediately, this guy needs immediate open surgery, meaning you have to open up the chest and find the bleeding. So yeah. But a lot of people, I don't know, most of the people patients I've had who got shot in the chest, they usually just they survived with just a tube. They didn't need like open surgery. So yeah. Did you do a similar surgery before, Doc? Yeah, chest tube insertion. I mentioned that a couple of times in my previous medical education streams. Okay. Alright, let's go to the next photo. How do I... is it... oh, okay, that's white. Wait, how do I switch? Wait, how do I go to the next photo? What the heck? Wait. Tangina, ano to? I don't know my hotkeys. What the heck? Hold on. I forgot what my hotkeys are for moving slides. Bruh. Oh, here we go. Oh wait, I don't have hotkeys. That's why. Oh, here we go. Here we go. Oh, this is why. Bruh. Here we go, this one. Wait, I forgot to set the hotkeys. I can't switch the... I can't even move the freaking slides. Hold on. Wait, let me look for it. Where's the folder? Bruh. Bam, bam, bam. Where is it? I can't find my... oh, there it is. Okay. Oh, there we go. Next slide. Alright, there we go. Okay. There we go! I got it! Wrist? My wrist is better. Don't worry about my wrist. I mean, I think it's getting better. As long as I don't write using my wrist or do any fine movements with my wrist, it should be okay. It should be okay. Okay, this photo, what do you think is wrong with this one? What do you guys think this is wrong? Actually, there's a lot of screenshots that show this. Like, a bunch of the screenshots I have of teleseryes and whatever, they're like this. They make the same mistakes. Yeah, this a lot of them have this. So this guy is intubated. Supposedly he's intubated. The tube is wait. What, the guy is intubated and then he has a oxygen in the nasal cannula. So, okay, I'll tell you guys what it is. Oh god, how do I show my mouse here? I can't show my mouse. I don't know how to show my mouse. I want to show my mouse. Anyway, the green tube you see that's around his face and into his nose is called a nasal cannula. It's called a nasal cannula. So what that does is gives oxygen. It's like you know, there are different ways to give oxygen. One is by a face mask, which is like a green, a transparent green mask that they put over your nose and mouth, and it gives oxygen. It kind of looks like those masks that they use when they give you for asthmatics and they nebulize you. It looks like that. So that's for oxygen. This one is nasal cannula. There's like little holes there to insert into the nostrils, and then it has oxygen coming out of it. Nasal cannula. Yeah. So this guy in this photo, he is intubated, meaning he has a tube supposedly. Actually, the way he's intubated is wrong also, but he is intubated, meaning he has a tube through his mouth that goes directly to the trachea, which is the airway that connects your nose and mouth to the lungs. Okay, that's what it is. So what's wrong here is that he's already intubated. When you're intubated, you're already hooked to a machine which helps you breathe. There's already oxygen there. So he's already breathing through the intubation or the tube in his mouth, and then they decided to put an oxygen nasal cannula through his nose also. Which isn't even needed. It's not needed because he's already intubated. Like, it's useless. It's actually useless. And the way the tube is inserted is also wrong. It's like, I don't know, it's like they just... Well... I mean, of course, I don't think they actually insert the tube into the actor, but they could at least make it look like it's inserted. The tape is just wrapped around the freaking tube. It doesn't stick to his face. It should be sticking to his face. Yeah, it's like double oxygen also. He has like intubated straight into his lung, into the airway of his lungs, and then he has an oxygen needle. Oxygen through the nose. Yeah, it's not needed because he already has a tube that goes directly to the airway. So it's like, bruh. There's a lot of these, actually. There's a lot. Most of the screenshots are like this. Hininga niya auto, kakainin niya auto. Okay. Okay. I got this from... This is also from Chronicles from MD. Actually, yeah, like I said, everything's from Chronicles from MD. So this is a freaking meme. This is a meme. So... This looks like a vacuum cleaner that was taped into her chin. Okay. So I think this is supposed to mimic intubation, but this is not how it's supposed to look like. Okay, wait, I'm gonna look for a photo of an endotracheal tube. Hold on. Endotracheal tube, here we go. Wait, where is it? Okay, here we go. Actually, yeah. The fact that the tube is taped to the chin, but other than that, aside from that, the tube is wrong, okay? This is not the tube used to intubate a person, okay? This looks like a vacuum cleaner. I don't know what this is. It looks like a vacuum cleaner. Look, okay, guys, I'm gonna show you, okay? Just so you get an idea. Hold on. Okay, here we go. Let me show this to you guys, okay? Okay, you see this? This is how an endotracheal tube looks like, or it's basically the tube they used to intubate you. So it looks like this. This is the one that goes through the mouth over here, this tip right here. And usually they intubate until level 20 to 22. They don't go deeper. Usually around this level. They insert it usually around here. And then this one over here is the one that's outside of the mouth. And once they're done intubating and it's done and it's positioned, this one is a... This thing here is connected to the balloon over here, so you inflate it. You inflate it so that the tube is locked in place. Okay? It's locked in place. But then even if it's locked in place, you have to tape the tube to the patient's face or mouth. Oh, here's a... Here we go. This is how it looks like when you intubate a person. Here. I think this is a better one. This is how it looks like when you intubate a person. So you put the tube through the mouth and up to here, the trachea, which is the airway. And then once it's in, you inflate this one with air, like around 7 or 10 cc of air. And then this cuff will inflate, so it kind of locks it in. But even if it's locked in, you have to tape this part to the patient's face. Yeah. Yeah, it inflates. It's like a little balloon. So, I think, is there a picture of how it's... Here we go. I think it's a good... Here. This is how it looks like. Yeah, like this. They tape it around and then they put the tape over in between your lip and your nose. So there's like a little bit of the tube sticking out, and then this part is the one that's connected to the machine. Looks painful. Yeah, it's uncomfortable. Hi Ryu! Hello Ryu! Hello. Welcome. Okay. Must be so uncomfortable. Actually, it is. It is when they're intubate and the process of intubating you is. That's why usually they sedate you when they do the intubation. They have to sedate you because it's really hard to intubate someone who's fully conscious. It's not painful, it's more of uncomfortable. They have a... I think, if I remember correctly, they have invented a endotracheal tube wherein it's not as hard or firm as this or rigid as this. I don't know where it is. Is it around here? I don't see it. There's one where I forgot what they call it. Endotracheal tube. What is it? I forgot what it's called, but there's an endotracheal tube wherein let's say this one, it's not as sharp as this. It's like a soft area, like a soft here, and it's not as painful. It just slides in very easily. I forgot what it's called because I don't see it that much. Yeah, it's uncomfortable when they start suctioning mucus from your lungs. Yeah. But then, you know, you'll need it. If you have like mucus building up there, you'll need the suctioning. I forgot what that one endotrach is called. I forgot. It looks like a little bulb. I don't even see it here. What if I say endotracheal tube comfortable? Will that help me? The more comfortable one. Okay, it's not here. It's never comfortable. I don't know. I forgot what it's called. There's an endotracheal tube that's like that. I forgot what it's called. or let's see, less painful, less painful. I forgot. Is it? No, they don't have it. I don't know what it's called. I forgot. Okay. Anyway, moving on. Alright, moving on. So, let's see, where are we? Okay, this one. I don't think this is a teleserye. But there's so much wrong in this photo. There is so much wrong in this one photo. It's ridiculous. there is so much wrong in this photo. I think you guys can like tell what's wrong here. This guy has like ECG leads on his face. He has ECG leads on his face and a pulse oximeter on his nose. Yeah, it's an oximeter. Okay. Now I'm gonna show you what's wrong here. ECG leads. Alright. Let's start with the ECG leads, guys. Alright? Let's start with the ECG leads. So, let's move this over here. ECG leads! So you see the stuff on his face right now. Those are ECG leads. Where you put on the chest. Okay, like you see here. They go on the chest, not on the face, okay? They can go in here we go. See this? The positions of the ECG leads. They go on the chest or the torso. Not on the face. Alright? And then the thing on his nose is a pulse oximeter. Okay, an oximeter. Oh. Which goes to the finger. Okay, this one is a portable one. A portable pulse oximeter, but yeah, you put it on the fingers. Not on the nose. Here it is. See this one. This is where it's supposed to go. The finger, okay? You see this? Ano yung context ng scene? I have absolutely no idea. I just saw this screenshot on Facebook and I just thought it was so ridiculous. Okay, so what is an ECG? What is a pulse oximeter? A pulse oximeter is a little gadget here. You can have a portable one, or if it's not portable, it's a clip that's connected to a monitor. It monitors your heart rate or your pulse rate and your oxygen saturation. Okay, so you can I'll show you. Wait, like if you see here, this one right here, see this? This is a portable one, by the way. The one on the right over here, the one that says 87, is the pulse rate. So he has 87 beats per minute, and then this one is the oxygen saturation, 98%. It's indicated up here. Okay. So, a lot of nurses or healthcare workers have this. They have a portable pulse oximeter, especially nurses in hospitals, because this is their quickest way. They can measure a patient's heart rate or pulse rate, and quickest way to get the oxygen level. But you know, sometimes the oximeter can be inaccurate when it comes to the pulse rate or the heart rate, because there are some patients who have arrhythmias or irregular heartbeat. So if you have an irregular heartbeat, the pulse oximeter will just start randomly giving you numbers. Like for example, it'll tell you, 87 heart rate, and suddenly the next second it jumps to 120, and then the next 2 seconds it goes back to like 70. It happens. So sometimes in patients like that, you take the heart rate manually. You feel the pulse for 1 minute, or for a full minute, and you count it. Yeah. I got 2 at my work, and 1 is the most inaccurate piece. Yeah, there are some that are really inaccurate. There are some that's really inaccurate. That's one thing. So you can't always 100% trust these things. One way to check if it's giving you the right value is you can check each finger, and if it changes for every finger, like if the change is really significant, then there's something wrong with your pulse oximeter. Mas effective sa'yo. Bruh. Okay, so there. Alright, next. Let's go to the next one. Okay. Okay. This is not the teleserye, but it looks like it's some Indian. It's an Indian. It's a Bollywood thing. So, I think they're supposed to be doing a defibrillation, and they're using Scotch-Brite. Yeah. So, at least they try to represent. Okay. First, let's see what's wrong here. Of course, the blatantly obvious one is that they're using Scotch-Brite. So they're gonna clean his body now with Scotch-Brite. So they could have at least put wires there. Defibrillator. Okay, I'm going to show you how a defibrillator works, okay? Hold on. Okay. So the most blatant, obvious thing that's wrong here is is that they use the sponge with handles, a bathroom scrubber, and the one thing that's wrong here in this and another thing that's actually wrong in this scene is that they are trying to defibrillate a person. Aside from them using Scotch-Brite as a defibrillator, if we look at the monitor, let's see, let's zoom in a little bit. If you look at the monitor, the heart here, let's look at the monitor here, okay? The number on top is the heart rate. The number on top, 71, is the heart rate. And then the middle one is the oxygen saturation. I'm guessing that's the oxygen saturation. 93. And I think this one at the bottom is the respiratory rate. So anyway, with those numbers, you do not defibrillate the person with those numbers. And wait, let me see. Yeah, this looks like a sinus rhythm also on his ECG. If you look at the rhythm of the lines, the heart rate. Ugh. Okay. Wait, hold on. So when do you use a defibrillator? Okay, I'm gonna close this for a bit, and I'm gonna show you defibrillator. When to use a defibrillator. So there are only 2 instances when you use a defibrillator, okay? And that is during a ventricular tachycardia or a ventricular fibrillation. So what is a ventricular tachycardia? Let me show you. Ventricular tachycardia. I will show you how a ventricular tachycardia looks like. Here we go. Here's a sample. If you have a heart rate, if you see the tracing of an ECG that's hooked to a patient that looks like this, This is ventricular tachycardia. You have to use a defibrillator. Okay? And the other one is ventricular fibrillation, which is basically eto sabog na ano. Sabog siya yung itsura niya. Which one here we go. It looks like this. That's when you use a defibrillator. You do not use a defibrillator on cardiac arrest. Not in cardiac arrest. If the patient arrested, the reason why you use a defibrillator is there to quote-unquote restart your heart. Okay? It's because you're trying to reset the rhythm of the heartbeat. So in a ventricular fibrillation, magulo. It's magulo yung rhythm. And also in ventricular tachycardia. So that you have to defibrillate the heart. It's like resetting the heart, the heartbeat. Increased heart rate and defibrillation. Not just increased heart rate. It's how the heart is pumping. There's different there's different rhythms or irregular rhythms of the heart. Different rhythms. The normal one is what we call sinus tachycardia. No, not sinus tachycardia, sorry. Sinus rhythm. The heartbeat has to be within 60 to 100 beats per minute. That's the normal speed. And it has to be regular. Like even and regular. If it's not regular, or like it doesn't follow a regular rhythm, then there's something wrong. That's not right. Flatline, no. Flatline is a cardiac arrest. You do not use a defibrillator. So some shows show a person flatlining, and they would say they need to defibrillate, which is wrong. It's actually wrong. You don't defibrillate someone who arrested. You actually don't. That's actually wrong. You only use a defibrillator in ventricular fibrillation when the heart is like this, or a ventricular tachycardia. I don't know if I don't remember if I discussed heart rates before. I think I did in a previous stream, like I don't know, in 2020. I could probably do another heart-related stream again, a medical education stream. So CPR is an option. Yes, CPR is what you do in a cardiac arrest. That is when, because in a CPR, you're trying to pump the heart. In a cardiac arrest, that means the heart stopped beating. CPR is when you assist the heart in beating again. You're trying to compress the heart, do chest compressions, and make the heart start beating. Okay. Yes, it is during cardiac arrest. Okay. All right. Let's go. We still got a lot of pictures to go through. All right. So, we're done with that. We're done with that. Let's see what's next. Okay, this one's another one. So we got another intubated guy with a nasal cannula. I did tell you that this is wrong. I already explained to you that when you're intubated, you do not need an nasal cannula, an oxygen nasal cannula, okay? Yung patay na puso na heartbroken, kaya ba i-assist ng CPR? Siguro pag sinipr ka ng crush mo, pumabubuhay ka. Sure. Alright, next. Okay. So Left 4 Dead's defib is wrong. Yes, actually it is. It's actually wrong. Alright, next. Okay. Wait, what is this? Oh, okay. I think the only mistake here is that the lady here is not wearing a mask. She's wearing protective, supposedly a PPE here. Not really a level 4 PPE, but she's not wearing a mask. I think that's it. That's the only thing wrong here, actually. But the intubation looks weird also. It looks like she just... It looks like they taped the big tube over her... on the side of her mouth. There should be another smaller tube. I already showed it to you a while ago. The endotracheal tube. Apparently they didn't put that there. Okay. Alright, next. Okay, this one. Oh my god, you can see someone... You can see the person's shadow. Okay, this one I think is supposed to be a person with a IV line, but instead they just taped it over her finger. They did not even try to make it look like there's a needle on her wrist. They just looped the... They just looped... They looped the macro set over her finger. So yeah, when you insert an IV line, let me look for this. IV cannula. Okay, here we go. IV cannula, okay. Alright. These are the different IV cannula sizes, okay? This is the one they put in your wrist. Alright? I'm a med tech, that is so wrong, I know. So look, yellow is the smallest one. The larger the number, the smaller the needle. So this is a 24 gauge. The lower the number, the larger the needle. So you got 14 is the largest one here. I have not seen a gauge 14 needle yet. The largest I've seen personally is a gauge 16, the gray one. So these are huge ass needles. These are huge ass needles. This one's over here. So after they put that here, this is how a needle is placed in the wrist. They look for a vein, they insert the needle, and once it's inserted, they put the where is it? Here we go. Peripheral cannula. I think this. Look, this is how it is. They connect the macro set or the lumen here. They do not loop it around the finger. That is wrong, okay? That is wrong. You do not loop it around the finger. Here, this is how it goes, okay? This is how it is properly placed. Oh hey, look, there's like different... See this? You do not loop it around the finger. Here's one that's on the wrist, okay? I hate needles the most. Yes, Ryu, we share this. I share the same sentiment. I'm actually terrified of needles when directed to me. Okay? Doc, is it true most doctors can't insert injections? It's not that we can't. It's more like nurses and medtechs are more trained for it than doctors are. We are taught how to do this in med school. And sometimes we do this also as interns. We know how to insert, but the nurses are much more adept at doing it. And of course the medtechs, they are better at it. So it's not that we can't. It's just that if anyone is more qualified to do this, it's a nurse or a medtech. Oh yeah, why does the IV can suck blood? What do you mean, why does the IV suck blood? What do you mean by that? It's actually supposed to go into a vein. Yes! It's quite called an IV line. It's intravenous. It goes inside the vein. That's how they give you fluids and your antibiotics and other meds intravenously. That's how it is. Or even blood transfusions. When you have blood transfusions, they use larger needles. I think they did the loop for stability. No. The stability comes from how you tape the needle or fix the tape. You do not put it on around the finger. Why? Because people use their hands a lot. The fact that it's here and if she makes a fist with her hand, Oh, thank you for subscribing, Hafiz Maki, guys. The fact that you can, if you loop it around the finger and she moves her hands a lot, it can actually yank on the IV line. Okay, so no. The secret is on how you tape and secure the line. All right, let's go next. Okay, let's go to the next one. Leon Steele, okay, thank you for stopping by my stream. Now I feel smarter knowing IV means intravenous. Yeah, IV means intravenous. That's why when they say IV medication, it's intravenous medications. That means medications they give you through IV. What does the antibiotic taste like? I don't know. If you can try the syrup, they taste sweet. Sometimes they taste like fruit. The pediatric one. Okay, what is this? Oh, okay, she's just not wearing a mask. That's it. I think that's it. I think that's the only thing wrong here. She's not. Oh wait, she is not wearing a mask, and this is not how you wear this cap. Okay, wait. Let me tell you. Let me show you guys. This is not how you wear a cap. Wait. What do you call this cap? This is a surgical cap. When you wear a cap, when you wear a surgical cap, guys, or a cap, you do not wear it like this with your hair falling off, falling down. Your hair has to be tied up, and it shouldn't be like this. Okay, the hair has to be hidden in the cap. Let me show you. You do not wear your cap like this. This is wrong, totally wrong. Aside from not wearing a mask, this is how it should be done, like this. Oh wait, this is a guy. You have to. Okay, here. This is a female. This is the bouffant cap. Here we go. This is how you wear it. Okay? You do not wear it with your hair flowing out of it. That is wrong and that is not sterile. But I am artista. They probably had to leave the hair down so that it doesn't mess up her hair. Okay. Can they administer antibiotics via IV? Yes, that's why there are IV antibiotics. So there are antibiotics for IV, for intravenous, for IV, and antibiotics that are taken orally. Okay, whatever is for IV, you do not give orally, and whatever's for oral, you do not give intravenously. Okay, next. Okay, this is another intubation. The one thing that's wrong here is that the tube is all the way inside her mouth. Remember I told you that when you insert an endotracheal tube, you don't put it all the way inside the mouth, okay? There is extra, you leave extra out because it depends on how. Here we go. Let me show this. There. Hers is all the way in. They actually shoved they shoved the freaking tube inside her, into her lungs. But I'm guessing they just did it. But I'm guessing the show did it this way because they weren't provided with an endotracheal tube that they can use, and then they just hooked the machine straight to her mouth. But this is not how it's supposed to look like, okay, guys? Not supposed to be how it looks. Okay. Next. What's next after this? Okay. So, aside from him being intubated, the tape being there wrong, and nasal cannula, the tube is not connected to a machine. Maybe that's why they put maybe that's why they put the nasal cannula, no? He's intubated, but it's not connected to anything. Maybe that's why they have a nasal cannula. When you intubate someone, you have to connect it to a machine or an ambu bag, okay? Because that's the only way they're gonna get oxygen through there. Wireless Bluetooth oxygen. Why is the tube cut? That is exactly the same question I would like to ask the people. Bluetooth oxygen, okay. Oh, yeah. This is new technology, apparently. Okay, next. Okay, this again, the tube is all the way inside the mouth. I think they just didn't have the endotracheal tube that they just connected everything. And actually this looks like an anesthesiology machine, to be honest. Yeah. Usually there's only one tube connected, but it looks like an anesthesiology machine is connected to this guy. I don't know the full picture. Bruh. Okay, this one. Okay. The most obviously wrong thing here is that they put way too much tape on his face. This is not how you tape the tube to the face. And on his nose, there's something. This is not how you tape an NGT. Okay, let me tell you what an NGT is. NGT. Okay, let me explain to you what is supposed to be here in this photo. First of all, on his nose, I'm guessing that is an NGT or a nasogastric tube. That is very weirdly placed on his. Very weirdly taped. That is not how you tape a nasogastric tube. And that is also not how you tape an endotracheal tube. Okay? I will show you how a nasogastric tube looks like. Let's go. Nasogastric tube. Okay. Nasogastric tube. This is how a nasogastric tube looks like here. It is a tube connected that goes through the nostril. Oh, here we go. This one. I can show it through this. Wait. Let me close this. All right. A nasogastric tube is a small tube that they insert through the nose. They insert it through the nose and it goes straight down all the way to your stomach. Okay. Oops. Ah. Oh no! What happened? Okay. That's why it's called a nasogastric tube. What is the purpose of a nasogastric tube? A nasogastric tube can be used for feeding. So let's say the patient can't tolerate eating on his own. They can give general liquids through the tube. It goes straight all the way down to his stomach. And another use for the nasogastric tube is for decompressing the stomach. So let's say the patient has cancer of the distal part of the stomach or has an obstruction, and then the stomach is filled with whatever he would drank or ate. The nasogastric tube can be used to evacuate whatever is in the stomach. So you just hook it to a bottle and then it will just come out through there. Okay. NGT stands for nasogastric tube. NGT, nasogastric tube. Okay, so how is it placed here? This is a better photo. Oh, they have a special tape for this. Look at that. This is a special tape. But there is a way to do this. Don't they have the one with like a... But this, anyway, this is how it's taped. Oops. This is how it's taped. Okay. So you just tape. If you have one strip of tape or a leukoplast tape, the brown tape, you just split it to give it legs, and then you tape it on the nose, and then you just the legs of the tape, you just spin it around the tube itself. That's how you tape it. Okay, not like this. This is literally just placing tape on the patient's nose. Okay, that's wrong. This is not secure. So if you yank on this, the tube will definitely come out. You want to tape it. You want to tape it this way. You want to tape it this way so that the tube doesn't easily come off. Okay. Doc, what do you call the tube used also for feeding, but it's directly inserted from the abdomen to the stomach? That would be a gastrostomy tube. Okay. Or a peg. Gastrostomy tube. Okay. Alright. Okay, next. Okay, in this photo we have a case of hair injury apparently, because these people have gauze on their hair. They have gauze taped to their hair because apparently they have hair injury. I don't know. I don't even know why they put gauze on the hair. But yeah. That's what's wrong here. So that's what PEG is. Yeah, PEG, percutaneous percutaneous. Yeah, it's called a PEG too, but surgeons don't do a PEG. It's there's two ways to put a tube in. There's two ways to put tube in the stomach directly in. It's called, one is a open gastrostomy, and the other one is called short as PEG. Percutaneous endoscopic gastrostomy. Okay, fine. Since you guys want to know, for Bread's information, because I think Bread's being thinking of something else for a percutaneous endoscopic gastrostomy. Here we go. Oops. Ah! I made a mistake. No. Percutaneous endoscopic gastrostomy. Here we go. Here we go. Percutaneous endoscopic gastrostomy, or PEG. Okay. Yeah, surgeons don't do PEG. It's the gastroenterologist who does this. It's basically a minimally invasive way of putting a tube through the stomach. So this is the tube. It goes straight into the stomach. Tinapay mahilig sa PEG. I think Bread is thinking of a different PEG. You are unsay so, Bread. Anyway, let's continue. Okay. So we got a case of hair injury here. Alright. This one looks like a Korean. This one came from a Korean drama. I think this is Korean or Japanese. I think it's Korean. So this is totally wrong. You do not put two NGTs on a patient. I do not know the context of this actually. But this is absolutely hilarious. This is funny because he has two tubes on his nose. You only need one. You only need one, okay? You don't need to put two tubes through the nose. Okay. All right, next. Okay, so We got another case of intubation being way too inside the mouth. There's always a lot of this. It is also taped weirdly. So yeah, there's that. And okay. Alright, this one. This is supposed to be an intubation, right? But let me tell you that the one thing that what's wrong here is the tube they are using. Let me show you what tube they are using, okay? The tube they are using is called a Yankauer suction. Okay? Yankauer suction. This is what they are using. This is what they're using. This is a suction tip. This is for suctioning. This is not for intubation. This is not for intubation, okay? This is a suction tip. Look, okay, this one. They use this in surgeries when you need to drain some fluid in wherever you're operating on, usually in abdominal surgeries or major chest surgeries. This is what they use, a Yankauer suction. So in this scene, they apparently used a suction a suction tip as an intubation. And I don't know, I have no idea what this is. There's like a strap on her chin. I have no idea what that is. Kinukuhaan ng oxygen. Yankauer. 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 Wait, let me can I type on this? Oh no, I can't type, bruh. I can't type on my own chat. Oh wait, here. Yankauer. There we go. Okay. Next. All right. So we have an IV bottle that's supposed to be connected to the patient. We have a nurse here who's, I think she's supposed to be giving something, but the IV line is not connected to the bottle. So there's no drip going on here. This is a trauma patient and they have an IV bottle, but that it's not connected to the patient. So that's one mistake. When you have a trauma patient or a patient who's under an emergency, you have to have IV line on the patient and he has to be hooked to fluids. Okay? Immediately. Almost immediately. Alright, next. Okay, we got another case of double oxygen. So, they taped it wrong. She is intubated. And she has oxygen, nasal cannula again. This is almost always the mistake here. Alright? This is almost always the mistake. They give too much oxygen. Bluetooth IV. Bruh. Bluetooth. Wait, what the heck? Okay, here's another one. We have a patient who's intubated, but it's way too long now. Look at this. It's like the tube is about to fall off her mouth. Because look how long it is. Like I said, it's supposed to be like near the end, but not totally. So this one is just like they taped the end of the tube to her, to the edge of her mouth. I don't know if it's a Yankauer. It looks like an endotracheal tube, but then they like taped it way too far. Okay. Wait, what? What is this? Oh, okay. All right. This is someone who needs to be defibrillated. So they did chest compressions, and then they're gonna defibrillate. What is wrong here is that when you defibrillate a patient, there shouldn't be any drapes on this. The defibrillator is directly directly on the skin. Okay. Actually, is this even a defibrillator? I can't tell. It's blurry. Yeah, they're defibrillating a cloth, which is no, it has to be on the chest, on the actual chest. Okay. So that's a mistake here. And yeah, when the defibrillation happens, you have to make sure that you're not touching the patient because you're gonna feel the shock as well. Bakit ang daming mali sa mga teleserye? Yeah, well, they don't. Some people just don't take the time to try to be more medically accurate, you know? Okay. As for this one, this patient is hooked to an anesthesiology machine. So, if you're hooked to the anesthesiology machine, that means you are being operated on, but I think they're trying to make this look like the ICU. The problem is this right here. The machine is an anesthesiology machine. So, and he's not being operated on. They used the wrong machine here, basically. And the tube is all the way into his mouth again. Yeah. They used the wrong machine here. Alright, let's see. Alice. Here we go. Anesthesia machine, see? So we got different kinds of anesthesia machines, and that one is one of them. Okay, maybe undergoing tooling. And a mech vent. What is supposed to be connected to him is supposed to be a mech vent or a mechanical ventilator. So that would be, where is it? What is the best looking mech vent here? This one, I think this. Oh, it's too small. Here. This is how it's supposed to look like. It's like a little monitor. See? Compared to what you see on the photo, it's an actual anesthesia machine. So yeah, that's their mistake. Okay. Just made him sleep. Alright. Next. Okay, oh, we're done with that. Okay, we're done with the screenshots. We're gonna go to Chronicles of MD. Okay? Because I know Chronicles of MD has a lot of videos. They have a lot of videos. Or clips. Wait, let me Okay. I know they have some clips here. Oh look! Hey, remember this? I think I showed this before. You don't just do this shit right here. You do not do this shit right here. Shit. That is not how you do CPR. Okay? If you want to do CPR, you can refer to my BLS VOD. I have a medical education stream where I talked about how you do basic life support. This is totally not how you do CPR, okay? Alright? That is not how CPR is done. You don't do this shit right here. No. Okay? That is not how. When you do CPR, you have to use the, you don't use your fingers, you use your palms. And you really put your back into it. You really have to push like 2 inches of the chest down. I mean, you push the chest up to like 2 inches down, okay? Not not just like lightly massage the chest with your fingers. Alright? That is wrong. Alright, let's see what else they got here. They got a lot of clips and stuff. Let's see. Oh, what's this? Hook to air pump stat? Bruh! Tangina, ano yan? Makeshift neck ventilator, you guys! Makeshift... Bro, how to make your own oxygen at home? Tangina! Okay, do not, guys, do not do that. Do not try that at home. Okay, do, do, do not do that. Do not try that at home. Oh god. Okay. Oh, what's this? What's this one? Oh, hey, it's... What? Hey, okay, in fairness... What? Oh my god. Okay, there's... Okay. Okay, guys. The tube is, guys, okay, for this right here... Okay. For this right here, the tube is okay. The tube is in almost at the right level, and it's connected to the machine. What they did wrong here is, you know, when you are intubated, you cannot talk, okay? Because you have a tube that passes through your mouth and through the airway, and that is including your voice box. So if you're intubated, you're not allowed, you cannot, or you are incapable of speaking. Okay? You are incapable of speaking, so this is wrong. This is totally wrong. Totally wrong. You cannot even make sound with your voice when you're intubated. Oh look, she died. She died. She died from trying to speak. Okay. Okay. You do not. You cannot speak when you are intubated. Okay, it's impossible. It is impossible. Telepathic speaking. Baka Bluetooth din yung voice niya, no? Bluetooth. What is this? Sorpresa? Ah, okay. Okay. What's this? Oh, okay. Bruh, okay. Okay. This guy has a tracheostomy tube. The tube is directly on his neck. I will show you, hold on. I will tell you guys what a tracheostomy tube is. Hold on. Tracheostomy. Oh, oops, what happened? Tracheostomy. Hello, Shika. Alright, this is a tracheostomy, guys. A tracheostomy is when you have a tube. Instead of, like I said, a while ago we always talk about intubations. So if a patient has been intubated for at least 2 weeks, doctors would advise that the patient have a tracheostomy done, because you cannot stay intubated for so long. Alright? So what they will advise is a tracheostomy, which is a surgical procedure wherein you put a tube through the neck and directly into the trachea. So it doesn't pass through the mouth, through the vocal cords, through the airway, and down here. Okay? So, there. And then there's also balloon. It's basically like an endotracheal tube, but shorter, and it goes directly into the neck. It's a tracheostomy. So, again, when you have a tracheostomy, you also cannot speak. Why? Michu, thank you for the sub. Why can't you speak? Because when you breathe, you're breathing through this tube already. So the air would go through here and not through your vocal cords. So I have no idea how he's able to speak when he has a tracheostomy tube. When he has a tracheostomy tube. There is a way where you can try speaking with a tracheostomy tube, but you have to have a special tube that doesn't have a hole. They use that for people to practice their speech before removing the tube. It's called non-fenestrating tracheostomy tube. But yeah, otherwise you can't really speak. Bluetooth voice. Yes, it's a Bluetooth voice again, okay? So he has a tracheostomy tube and he was able to speak. And perfectly normally too. So there is a way they can actually speak with the tracheostomy, but that is like when they use a non-fenestrating tube, and if the patient is not like freshly operated on, it takes a while. So according to the comments here, this episode, he was like immediately, he's post-op, meaning he just had the surgery, so he's really not supposed to be able to speak at all. Okay. Alright, next, let's see. Oh. What? Wait for it, what's this? Why is there? What the heck? Okay. Ah! Okay, there we go. This one, alright. Okay, so the wrong thing there is that they use a defibrillator on a flatline patient. Okay, that is wrong. Yeah, it's supposed to be CPR. When they gave the epinephrine, that's correct. They do that. They do give epinephrine when you do CPR, but not a defibrillator. Okay, that patient was flatlining. Yeah, that's wrong. Kasalanan nila namatay yung babae. Alright, next. Oh. This scene involves an actor playing the...
Nagising na ho si Mama. Bakit ho siya ganito? Ano nangyayari sa kanya? Mama! Mama, tama na ho!
Wait, she's speaking when she's intubated.
Oh. Pwede ba umalis ka na? Hindi ka namin kailangan dito. Wala ka maitutulong dito. Layas! Oh.
You're angry.
Halika na. Lumabas na tayo. Halika na.
Umalis ka na! Manang palabasin mo na yan dito!
Halika na. Halika na, halika na. Halika na.
She's intubated and she can moan while intubated.
Doc, please explain to us. Ano bang nangyayari kay Mama? Bakit hindi mo siya nakikipag-usap sa akin?
Your mother has aphasia, Miss De La Rosa.
What?
What?
Aphasia?
Isa itong communication disorder dahil sa tinamo niyang injury sa utak niya.
Dok, naiintindihan naman niya kami, di ba?
Oo naman po. Mahihirapan lang siya magsalita but she's on her right mind.
Paano mo siya gagaling?
Pagpapatuloy po namin ang pagbibigay ng gamot para sa pamamaga ng utak niya in the next few weeks. Then we will also provide an occupational therapist to help her condition her body. And maybe after a month, magkakaroon ng improvement sa speech niya at ang motor skills
Okay.
niya.
Salamat sa Diyos.
Okay. This whole scene is wrong. This whole scene is wrong. Okay, this whole scene is so wrong.
Nagising na ho si Mama.
first of all, when you are intubated, you cannot speak. You are unable to speak because there's a tube through your mouth and through your throat, through your vocal cords down to your airway, right? And then she's like asking, and then she was able to moan. She was able to moan while intubated, which is impossible. Okay, now in the next scene, they are worried about her patient, and they're asking what's wrong with her, and the doctor says she has aphasia, and I'm like, what? How? How did they diagnose aphasia when the patient is not supposed to be able to speak because she's intubated? So yeah, that entire scene is wrong. You can only diagnose aphasia if she really cannot speak, but this time she is supposed to be incapable of speaking because she's intubated. So so you cannot diagnose aphasia that way. But di siya nagsasadya. Yeah, aphasia. Aphasia means you're unable to speak. It's a neurologic condition. You can't speak. Tama ba yung diagnosis ng doktor? No. Because that's not how you diagnose aphasia. Explain aphasia. Aphasia is when you lose your ability to speak, like because of brain damage. So the way the doctor explained it is kind of right, like how he said aphasia is a neurologic problem. It's caused by brain damage. Okay, but you cannot diagnose that because the patient is intubated. So how would you know she has aphasia if in the first place she is incapable of speaking because of being intubated? You can only diagnose that if she is in a condition where there is nothing mechanically preventing her from speaking. Okay, that's the issue here. She is intubated, so how are you able to say she has aphasia? But then again, she was able to moan while intubated, which is also medically wrong or medically inaccurate. You cannot make sounds with your voice when you're intubated. Okay, so yeah. Alright, let's look at our next clip. Wait, is that it? Oh wait, there's more. I know there's more. Hold on. What? Where's the... Oh. Is that all the videos they have? I know they have more. You know. Wait. I know there is one... I remember one scene. There was one clip where... Hold on. Let me look for it. There is one clip I need to show you guys. I'm looking for it though. I don't know where it is. There was one clip I saw. I forgot what show that was. Wait, no. Wait, let me look for it. Here we go. This one right here. Hold on.
Roberto Marias.
This.
Ako, yung nanay niya. Kumusta na yung anak ko?
According to our initial findings and assessment, tinamaan ng bala sa ribs at appendix ang anak ninyo. We
What?
have yet
Wait.
to explore kung may sasalba pa namin ang appendix niya.
Ano pong
Yeah,
magyayari?
He needs to undergo operation.
Yeah, this is the
and
one.
blood
This is the
transfusion
one
as soon as
in the
possible.
first screenshot, I think.
Dok, gawin niyo po lahat ng magagawa niyo.
This is the one in the first screenshot
Babalitaan ko
that I
lang.
showed you. Let's listen.
Sino kaanak ni Roberto Marias?
Ako, yung nanay niya. Kumusta na yung anak ko?
According to our initial findings and assessment, tinamaan ng bala sa ribs at appendix ang anak ninyo.
He got shot in the ribs and he got shot in the ribs and on the appendix. Okay. I have no
We have yet
idea
to explore kung
how.
may sasalba pa namin ang appendix niya.
got shot on the ribs and his appendix, and they were able he was able to apparently assess that the appendix was shot, that he and he wants to save the appendix. Okay. He wants to isasalba daw yung appendix.
He needs to undergo operation and blood transfusion as soon as possible.
Dok, gawin niyo po lahat ng magagawa niyo, please.
Sige po, babalitaan ko kayo agad.
Oh god, okay. Okay. Yeah. So if ever you do get shot on the appendix, let's say for some, if you are quote unquote lucky or unlucky to get shot in the appendix, okay, you don't save the appendix. You don't try to save the appendix. Just remove the appendix, okay? You if your appendix has any damage or inflammation, just remove the damn thing. You don't save it, okay? Yeah. Why the appendix? I don't know. He apparently got shot in the ribs and the appendix got affected. Science says the appendix has a purpose. Well, yeah, it does have a purpose, but you can live without an appendix. The purpose of an appendix is more on like on the lymphatics. It's a lymphoid tissue. So, but then your body has like a lot of lymphoid tissues. You don't run out of it. Brang galing naman ng bumarel ribs tapos What is appendix for? Appendix is a lymphoid organ that is attached to your colon or your large intestine. Let me show you. Hold on. Appendix. Wait. No. Appendix. Here we go. Appendix. Here. There. It's like a little tail in your large intestine, okay? It is a lymphoid tissue. Before, people would say that it serves no purpose because you can actually live without your appendix. But it's a lymphoid tissue, therefore it's part of the immune system, but you don't really need it. I mean, you can live without it because you have a lot of lymphoid tissues in your body. It has a purpose in the immune system. So we can live without balls if the appendix is just an appendix in our bowel. What? You can live without balls if the appendix is just an appendix in our bowel. What do you mean? I didn't understand your question. It's called vasectomy. What? Vasectomy is when you cut your vas deferens. What the heck? That's so far away from the appendix. Ilang inches layo ang ribs sa appendix? Well, your appendix is in the right lower quadrant. Like, if you see here, your appendix is here. Your ribs are up here. So I have no idea. He got shot here, I don't know, with the bullet ricochet through his ribs. Nabaril siya sa ribs, bumaba dito. Can you live without your balls? Yeah, you can. You can be a, that's why eunuchs existed, right? That's what eunuchs are. Appendix or appendicitis? Appendix is the organ, appendicitis is the disease. Appendectomy is when you remove the appendix. Okay. Alright. And I think that's all. Hold on.
Sino kaanak ni Roberto Marias?
Ako yung nanay niya. Kumusta na yung anak ko?
Yeah. So, for those who don't know, this is where I got my source. So, a lot of my source screenshots, most of them, except actually all of them except for the last clip, is from here, Chronicles of MD. The doctor is I mean, the one who made the page is a doctor. I don't know what kind of doctor she is. I think she's I don't know if she's an internal medicine doc or whatever. But a lot of healthcare workers follow this page. So yeah, if you're a healthcare worker, a doctor, a nurse, you might have fun looking at this page. She posts a lot of memes and stuff. Yeah, funny stuff. Very medical stuff. like this one right here. You see this? This is a perfect image of what I feel when I have a needle, when I am going to undergo injection. You know? And what else? Ooh. So we got a lot of memes here. Yeah. There's a lot of memes here. She's a cardiologist. Oh, okay, she's a cardiologist. Okay. I didn't know what kind of doctor she was. So she's a cardiologist. Okay. Yeah. So there's a lot. If you wanna follow her, if you want like medical memes, you can go here. Sometimes they post like other funny shit. Like this. I love dumb MD memes. Yeah, this one, she has a lot. Yung ayaw mo na maging doktor. I feel I am the undiscovered supermodel, bruh. Alright, so yeah, I think that's all actually. Hold on. Yeah, that's all. What time is it? It's 10:19. We've been how long has my stream been? 1 hour 45 minutes. That's actually long enough. Medical meme review? You want me to do a medical meme review? You want me to do a medical meme review? I could, I guess, like in the future. I can like look for medical memes. Anyway, we could do a medical meme review surgery version. Okay, I'll keep that in mind. We can do that in the future. Alright. Thanks for the stream. That was very all over the. It was very all over the place. It was very over the place, bruh. This reaffirms my belief that teleseries never get better. We can do a medical review. I will see in the future while my wrist is still, you know, in the process of getting better. Actually, my hand isn't as swollen as it used to be. It's less swollen now, but I still can't use it, so yeah. I still can't play hardcore games. So probably next week my streams will be more, you know, chatting streams, non-gaming again. Alright, but yes, Otsupon everyone! Thank you so much for coming to my stream. I hope you guys learned a lot. I hope you guys learned a lot. And I don't have a stream tomorrow, so I'm kind of busy tomorrow, Sunday tomorrow. I'm busy. So I will just post a stream schedule of the week in the morning tomorrow. I think I'll make my stream schedule now and then I'll just post in the morning. Yeah, I wanted to play Elden Ring, but yeah, I can't with this wrist. With this wrist, I can't. Okay. So, Otsupon everyone! Unfortunately, I'm on YouTube, so I can't really raid anyone. No raids on YouTube. Thank you everyone. Good night everybody. I'll post my stream schedule soon, okay? Goodbye. Good night everyone. Bye bye.